Okay.
Good afternoon, everyone. Before starting, I would like to thank the organizing committee for inviting me to such a successful event. And النهارده my lecture will be mainly focusing or tackling the laser and the new devices as a treatment option used recently for genital rejuvenation and vaginal rejuvenation. As you all know, females are always seeking treatment option to improve both the appearance and function of their external and internal genitalia. However, they face always a big challenge dealing with the physiological changes that occur throughout their life: childbirth, weight fluctuation, and hormonal changes. And all these factors contribute to the development of the vulvovaginal laxity, driven mainly by the destruction and the degradation to the collagen and elastin fibers. As a result, the loss of strength and flexibility that occur within the vaginal wall lead to the development or decrease in the sensation and the development of stress urinary incontinence. Before, we had the surgical and the medical treatment option to deal with such a situation. However, nowadays, these surgical and medical procedures are supplemented with a non-invasive laser and energy-based devices, as long as the other treatment option, filler or shot, G-shot, and so on. طيب. وبالتالي دلوقتي في females كتيرة fearing من ان هم undergo surgical procedure، بقوا كتير يهتموا ان هم يعملوا non invasive procedures ديت، ومنها الليزر والenergy based devices. طيب، ومن هنا بدأ emerge الترم genital or vaginal rejuvenation. So what is genital or vaginal rejuvenation? Genital rejuvenation is a very broad term used to describe a range of aesthetic and functional procedures that correct and restore the optimal structure of the vagina and the surrounding structure. And this vaginal or genital rejuvenation include a spectrum of treatment that aim for tightening of the vagina, to treat the vaginal atrophy, and to eliminate the dryness and itching and stop the continence. طيب، ومن هنا بدأ يجي طيب ازاي how to evaluate and assess and monitor the success of the vaginal rejuvenation or genital rejuvenation and the tool used for this rejuvenation. بدأ يجي a validated tool has been developed اللي هو vaginal health index, which is a scoring system used to evaluate the elasticity, moisture, pH, epithelial integrity, and the fluid volume or the fluid secretion within the vagina. طبعا patient is getting a score at baseline, then with follow-up السكور ده احنا we can follow with this score the improvement with the patient while doing any kind of laser or energy-based devices session. طيب, we have the laser. The first option is the laser. Laser for vaginal rejuvenation is a novel non-hormonal treatment approach used for genital rejuvenation as well as the treatment of stress urinary incontinence. The concept behind laser procedure is to treat the vulvovaginal condition using a specific wavelength that a high affinity to the water to ablate and coagulate the vagina and the valvular tissue. And by consequence, a wound response is initiated and result in tissue remodeling with the formation of collagen and elastic fiber in this atrophic mucosa or atrophic external genitalia. The muscle tone of the vagina is then restored by tightening the supportive structure of the vulvovaginal complex. The first laser we always use for the sake of vaginal or genital rejuvenation is the fractional CO2 laser. Fractional CO2 laser is a minimally ablative laser that allows for focus energy delivery in an island of microablation surrounded by adjacent healthy tissue. And this adjacent healthy tissue allows for regeneration of the area of microablation. The fractional CO2 laser has a wavelength of 10,600 nanometer and located in the far infrared spectrum. Its target chromophore is water and collagen. So it has a deeper penetration into the tissue of the vagina, leading to a more downtime, and the risk of complication with CO2 laser is high when compared with the other treatment option or the other laser used for the sake of vaginal rejuvenation. The fractional CO2 laser is indicated or used mainly in cases of vaginal laxity, stress urinary incontinence, vaginal dryness, dyspareunia, dysuria, and burning sensation. The first section show the atrophic epithelium within the vagina before the application of laser or CO2 laser, and the second section show the improvement after one session of Mona Lisa touch. This improvement in the thickness of the vagina is reflected also in the symptoms experienced by the patient. As we see in the graph, vaginal atrophy is improved in terms of burning, itching, dryness, dyspareunia, and laxity. Also, the urinary symptoms are improved after 3 sessions of Mona Lisa touch. This was a trial conducted using the Mona Lisa touch versus placebo. Another type of laser used for the sake of genital rejuvenation, which is the erbium YAG laser. It has a wavelength of 2,900 nanometer located in the mid-infrared spectrum. Its target chromophore is water only, and it has affinity to water 16 times more than the CO2 laser. The depth of penetration is lower. It penetrates up to 1 to 3 micrometer only. It has a minimal thermal injury, so the risk of developing complication in the downtime is less than the CO2 laser. The erbium laser is indicated in cases of vaginal laxity or atrophy, stress urinary incontinence, mild and moderate cases, and grade 1 and 2 pelvic organ prolapse. The graph is showing the result of incontinence erbium laser at baseline at 3 and 6 months and after 1 year. The technique of post-procedure are similar. يعني احنا ال CO2 laser application والerbium YAG application هما تقريبا الاثنين واحد. احنا بنinsert a specific vaginal speculum, then the probe of the laser is inserted into the speculum with no contact with the vaginal mucosa. بعد كده laser is emitted or irradiated to the vaginal wall. Then we withdraw gradually by 5 millimeter each time the probe till we complete the full length of the vagina. The procedure is not lengthy. It takes يعني almost 10 to 15 minutes. But before we start the procedure, we apply a topical anesthetic cream for 30 minutes, followed by the procedure. Interval between each session and the consecutive session is 4 to 6 weeks. يعني كل session لازم نسيب space apart 6 weeks، وده لأنه إحنا mechanism of action of laser is depending mainly on wound healing process and stimulation of collagen remodeling. So we should leave appropriate space or time between each session. What about the energy-based devices? We have the radiofrequency. Radiofrequency is one of the most innovative approaches to treat the vulvovaginal laxity and the stress urinary incontinence. It gained popularity because it is a non-invasive and due to the absence of adverse event and the rapid and satisfying response. The RF system work on the principle of Joule heating. ده معناه إيه؟ إنه once we apply RF current, it face resistance from the tissue leading to thermal injury, and this thermal injury stimulate inflammatory cascade and wound healing process, leading at the end to the development of new collagen and elastin within the mucosa. So what are the indications of the radiofrequency? The radiofrequency is indicated in cases of vaginal laxity, stress urinary incontinence, and variable degree of orgasmic dysfunction. Lastly, we have the high-intensity focused ultrasound or HIFO. The HIFO is a very advanced technology that focus energy transmit to target and desired depths without any damage to the skin surface أو mucosal surface. This is why الهايفو دلوقتي عليه high demand، لأن بصراحة الداون تايم بتاعه والrisk of developing complication is very minimal أو تقريبا absent when compared بال CO2 laser اللي دايما العيانين بعد السيشن احنا دايما بنinstruct العيانين إن هم they are going to face face some kind of edema, watery discharge, burning, itching. الsymptoms دي أو المانيفستيشن دي will last for a very small period. However, بيبقى في بعد السيشن داون تايم period ودايما بنأسك البيشنت انه she can experience these symptoms for almost 10 maximum 14 weeks or 2 weeks. 14 days, sorry, or 2 weeks. However, in case of hypho, the patient can resume her normal activity, her intimate relation after 2 days of performing the procedures. So HIFO use focus ultrasound energy to target a deeper layer of the tissue below the surface or the superficial or the mass system. The ultrasound energy causes the tissue to heat up rapidly and the cells are damaged, leading to the development of inflammation, proliferation, and remodeling and maturation of the collagen that occur after 3 to 4 weeks post-procedures. The HIFO is indicated for vaginal tightening, the dryness, it ameliorates or improves the dryness, and used in cases of stress urinary incontinence. This is a comparison between the HIFO laser and RF in terms of the depth of penetration, and as you see, the HIFO has the deepest penetration to the tissue, and for sure, very satisfying results to treat vaginal laxity and vulvovaginal atrophy. Take-home message. Despite the high prevalence and the negative impact on the quality of life, the vulvovaginal atrophy and stress urinary incontinence are underreported by women, under-recognized by gynecologists, and therefore undertreated. The choice of treatment depends on the severity of symptom, effectiveness, and safety of the therapy for individual patient and patient. For sure, the patient preference is very important and very crucial. Lasers and energy-based devices are effective in treating symptoms associated with vaginal laxity, stress urinary incontinence, with an acceptable safety profile. Further clinical study, especially randomized clinical trials, are needed in order to assess the long-term safety and efficacy of lasers and energy-based devices in order to obtain approval of the different health authorities. Thank you for your attention.